Hello, this is Jedsia Brown, and this is my research dissemination assignment, Therapeutic Communication and Aggressive Behavior De-Escalation. My PCAP question is, in psychiatric patients, how does the use of therapeutic communication compared to non-therapeutic communication reduce and prevent aggressive behavior? What is therapeutic communication? According to a nurse, therapeutic communication is communication between a healthcare professional and a patient that is aimed at improving the patient's physical or psychological health and well-being. Therapeutic communication techniques have their roots in psychotherapy, include a combination of verbal and nonverbal strategies. In face-to-face situations, therapeutic communication centers on the patient or client. Why is it important in nursing? So therapeutic communication is important in psychiatric nursing because it helps to de-escalate aggressive behavior and prevent clients from being placed in restraints, which could further traumatize an individual. And in the population of clients that I care for, many of them have already experienced trauma. So the goal is to not have that experience as a reoccurrence and further cause more trauma. So therapeutic versus non-therapeutic communication. Therapeutic communication is listening, offering yourself, silence, empathy, and open-ended questions. And then we have non-therapeutic communication, which is personal opinion, giving false hope, which is saying everything will be okay when we're not sure that everything will be okay. Changing the subject says that you don't care what they're talking about. Sympathy and arguing. Arguing is the last thing you would want to do with a client who is experiencing aggressive behavior. So what does the research say? Therapeutic communication is especially essential with patients requiring psychiatric care in order to apply nursing process effectively and perform successful intervention. Acknowledging and validating patients' feelings and reassuring them that the staff is there to help them is one good strategy that could reduce the level of agitation, because this gives permission to the patient to communicate their feelings and concerns without interruption. Research goes on to say that psychological interventions help patients to achieve control over their aggressive behaviors. In addition, these interventions can also eradicate the need for chemical and mechanical restraints and communication strategies, or significant intervention can prevent a crisis situation. Nursing staff can be unnecessarily injured while placing a patient in restraints, whereas the use of non-physical de-escalation techniques involves little risk of injury. So, research dissemination within my facility. Networking with my colleagues. Having poster boards up that allow them to come over, review information, and then give immediate feedback. Then there's the development of a video that could be uploaded to the intranet or the internet. Our book speaks on using the digital age, because that is the age we live in. So videos could be uploaded that show examples of role playing of therapeutic communication versus non-therapeutic communication. Then presentations of PowerPoints that deliver information, and those can be reviewed weekly in the weekly nurse meetings. And then you can distribute handouts, pamphlets, and scholarly journals that support your evidence-based practice. Dissemination timeline. Presentation to nurse managers and nurse educators. I said nurse educators because those are the ones who really facilitate new procedures being brought to the forefront and to the wards in our facility. Then quantitative review measures. This allows you to be able to determine how well the information is being retained. And then collaborate with coworkers to bring research to point of care. Require detailed charting of behaviors during the shift to compare data to determine the effectiveness and the reduction of escalating behaviors. So when a client has a aggressive behavior episode, you could have the nurse chart the behavior, her intervention through therapeutic communication, and the outcome. That would help you to gather the data to find out if therapeutic communication is effective, and it would also show if there's a reduction in the use of restraints facility wide. And then you want to receive feedback. Here are my references. Thank you for viewing my PowerPoint. Have a great day.